Laser liposuction, hot topic. You do a lot of it.
Yeah, so we do laser liposuction in our practice as well. And I like to think of our practice and our center as a total transformation package. There's some patients who are good cool sculpting patients. There are some patients who are good liposuction patients. There are some patients who are both. Now, with this technology we have, we actually use the Alma LipoLife. It has the ability to pull out the fat, store it, and then with the proper consultation, actually re-inject the fat into the breasts. We've done some breast lifts, to the buttock, or even into the face. And I think that's really the future of liposuction.
Are there stem cells in those fat?
There are. And so these fat cells are actually enriched with stem cells and other kind of healing properties, which explains why there's a take rate into the breast, or when you use it in the face, you have such outstanding results.
So how is laser liposuction different than traditional, I guess, tumescent liposuction?
Well, laser liposuction does incorporate some principles of tumescent liposuction, except that the cannulas are smaller. There's a laser, fine laser at the end of it, enable us to do a lot of very fine detailed work with the cannula. Because there's a laser, there's heat, so there's some skin tightening effects and benefits as we do laser liposuction.
So the
as
laser
well.
is more for the tightening of it, or more for it helps break up the fat?
Actually,
or both?
Actually both. So now I've actually done both. So I've done traditional liposuction, and I know when I've done it because my shoulder pays for it in the morning.
Okay.
And I've done laser liposuction where I go in and I use the laser cannula to break up some of the fat before I start pulling it out. Now, what it means to the patient is that you have additional skin retraction and skin tightening, and there's less bleeding because there's a heat at the end of the laser that actually helps with coagulation as well.
Okay, now with these women, what's the average age of the people getting liposuction these days?
We've seen the whole gamut, Randy. Most patients who are coming in are over the age of 30. We've seen some late 20-year-olds, but I've seen the full gamut. We've seen
How old can you be to get this done? And how old are they that are coming in?
Well, it depends. We have 60-year-old patients who are healthy. They're healthy with regards to their heart. The rest of their body is healthy, but they just have these stubborn pockets of fat that they can't seem to get rid of.
Are you combining it with like hormone replacement therapy as well?
Absolutely.
With the pellet therapy?
And I think that's really what we're known for in our area, is that Dr. Tangchitnob's practice is a whole body approach. We look at your hormones, we look at your hormone status, we're optimizing hormones. I've actually had to say no to a few patients because I think they should lose some weight first, or maybe patients who had signed up for lipo. I had a patient sign up for a body sculpting procedure, end up losing weight, and was very happy with those results. And so I think by having every procedure and every kind of ability, technology in our practice, we really do give the patients a full spectrum of options and choices that benefits them.
Now, I know you're big on cool sculpting. Is there a place of a combination of laser liposuction and cool sculpting?
Absolutely.
Do they ever go together?
Yeah, I think they could go together. I think that patients who maybe start with cool sculpting and there are other areas of the body that they want to get rid of more than just the 20-25%, or they want it more immediate, might end up going down the liposuction route. Absolutely.
So do you believe that if you're going to get cool sculpting, go to somebody that both does liposuction and cool sculpting to get an honest opinion?
I think that if you're considering body contouring, you should basically see if the provider provides cool sculpting, laser liposuction, and hormone optimization in one place, because I think that's really going to be the best result.